We are taking a closer look this morning at understanding pediatric care. What every parent needs to know about ensuring the health and well-being of their children, from routine checkups to medication. There are many different ways to approach ADHD. Joining us this morning is Dr. Gurender Sahani, board-certified psychiatrist at the Charlotte Hungerford Behavioral Health Network. Doctor, thank you for your time.
Thanks for having me.
Of course. Let's start with the common signs and symptoms of ADHD.
So ADHD is one of the most common neurobehavioral disorder of childhood, which can profoundly affect children's social interactions, well-being, as well as impact adversely lifelong academic and professional achievements. It is usually presents with persistent difficulties with inattention, hyperactivity, and impulsivity that is out of proportion to the developmental expectations. So what is attention? Attention is a dynamic process that involves the ability to select and maintain the focus on important stimuli, which involves not getting distracted by competing stimuli or the background noise. It also involves the ability to shift back and forth fluidly and dynamically between scanning, background environment, and the main focus. So usually for diagnosis, we use DSM-5 diagnostic criteria, which is basically two symptom clusters, the inattention and the hyperactivity and impulsivity. So the inattention characterizes basically parents will present and the child will have issues with focusing, concentration difficulties, will get distracted easily, and has difficulty completing academic assignments or finishing other tasks, is disorganized, is forgetful, who loses and misplaces things while doing academic assignments, makes careless mistakes, and fails to pay attention to the details. Right. When it comes to the hyperactivity or impulsivity, the child cannot sit still. He's constantly running around, climbing excessively. Parents will come and sit. He's constantly in things, he's climbing kitchen counter, jumping off the couches. He does not play quietly or work quietly. Parents will say like the child is driven by motor, or he's like Energizer bunny that keeps on going and on and on. He's impatient, can't wait for his turn, interrupts, blurts out answers. And usually, if you further look at ADHD, it can present as predominantly hyperactive or impulsive, depending upon if it's the hyperactive, impulsive symptoms more prominent, or inattentive. And then sometimes it is combined presentation with both symptoms are present. Usually patients present before age 12, and these symptoms are usually present in 2 or more settings. And again, it impacts the child's social, educational, and occupational functioning. Okay. And boys are more often diagnosed with as compared to girls. And even though across racial profiles it is equally prevalent, it is less frequently diagnosed in non-white patient population.
Wonderful. And quickly, doctor, before we go here, we just understood from you the how you go about diagnosing a child with ADHD, but how do you go about managing a child with ADHD?
So that was those were the symptoms that the child will present with. Once the patient comes in with parents because there are behavioral difficulties either in daycare center, preschool, or elementary school. And once they come in, most important is ADHD is a clinical diagnosis. So what we need is a comprehensive history taking, so which that involves interviewing the parent and the child, then also making sure we get the information from the school, because that is that's why where the patient is having, the child is having a lot of problems. So we get information from the school, we do rating scales, which could be like Vanderbilt's or Connors or SNAP, that different providers use different scales. So they can, and so we do the clinical interview, which is basically tells us the onset and development of the symptoms, the patterns, how they're presenting in different settings, how is impaired, affecting the sleep, screen habit. Then we also need to make sure there are a lot of comorbidities that present with ADHD. So we talk about family history of ADHD, anxiety, mood disorders, and ask if those symptoms are present in the patient or the child as well. And if they're presenting like around teenage years, we need to also find out about substance abuse. So when you have all these history, then you look into treating the patient.
Right.
And
Okay. Well, Dr. Sahani, we appreciate your time. All good information, and we appreciate the work that you do. Thanks for joining us.
Thank you. Thanks for having me.
Of course. Good.